And it may influence other illnesses. If you have erectile dysfunction, it can make your depression worse. And if you're depressed, you most likely have erectile dysfunction. So why is this so important? Here's the inner lining of a blood vessel. There's endothelium, which is basically just cells that line it, and there's smooth muscles around the blood vessel cell, just like there is in the penis. And the penis really is the window to the heart. It tells us what's going on in the vascular system. It's kind of like the canary in the coal mine. If you're starting to have erectile problems, it's a sign that there's something going on in your vascular system, most likely. Okay? There is erectile problems from nerve problems, but most of ED is vascular. And the reason they think that is because if you look at the penile artery, it's like a far extended branch of a tree, so it's small. It's smaller than the arteries around your heart, your coronary artery, and it's certainly smaller than the big artery in your neck. So if you've got some difficulties getting blood to through those small arteries, you can imagine that that's going to precede the problems that you might see in your heart. So it's kind of a warning signal. And if we actually look at men who have never had a cardiovascular event, but who then get erectile dysfunction for the first time, if you look what happens to them over time, the rate of cardiovascular events increases. For example, if you've had erectile dysfunction for 5 years, 11% of those men who've had ED for 5 years and never had a cardiovascular event before will have one within 5 years. And this graph just keeps going up. So, ED may be an early marker of cardiovascular disease, and the association appears to be on the same order as people who smoke heavily, and we all know that you're going to have cardiovascular problems with that, or who have a family history of having a heart attack. So this is a very important marker that you need to pay attention to. And as Dr. Goldenberg said, when you have a young man who's got ED, he needs to be worked up, let alone an older man, because it is a flag. And the reason it's a flag, we think, is because that lining of the blood vessels, anything to do with hypertension, which is your high blood pressure, diabetes, the extra lipids, or smoking, the excess weight, the metabolic syndrome, all that sort of thing, it's a risk factor for damaging the lining of your blood vessels. And what does that lead to? ED, renal disease, strokes, MI. So it is a very important marker. But the problem is, and the mayor alluded to this, people don't seek help. About 10% of men will go to see their doctor regarding some sort of sexual problem. That's not very much. A lot of men hang in there in silence because they're too embarrassed to come forth. And part of our mandate in men's health is to teach physicians to ask more about this. It's not just up to you. So when you have a sexual concern and you go see somebody, what is your doctor going to do? He's going to ask you about your personal medical history, your risk factors for this ED. He's going to do a sexual health assessment, look at your interest level, your erections. Is there any changes to ejaculation? Any changes to pain with any sexual activity? Going to do a physical exam, including a rectal exam, which is not that bad, especially by these 2 urologists. And maybe some blood work, and some blood work. So the blood work may include what are your lipids, what are your blood sugars, what is your testosterone. Okay, these are all normal workups for your sexual health. And there are some specialized testing, but we can talk about that later. So if your testosterone is low, you have to assess the risk factors, and your doctor may decide to put you on some testosterone, not to make your testosterone abnormally high. By the way, if you are low testosterone and your testosterone levels get replaced to a normal level, that does not make you angrier or more aggressive. It actually lowers your crankiness and your irritability. It's when you have too much testosterone, like some of the guys in the gym do, that you get really aggressive. So that's a big concern for a lot of partners. If you give my husband testosterone, he's going to get even worse. And actually, he calms down because the low testosterone makes him irritable. And you have a choice between taking testosterone in a pill form, which you need to take probably 3 to 5 pills a day, and you need to take them with fat or they don't get absorbed. So popping a pill in the morning after brushing your teeth goes right through you. That's why the pills don't work sometimes. Or you can take it through your skin, through patches, okay, or you can use gels. And gels, Testoderm, Androderm, those are some of the gels that are available. Or you can do it through an injection into your muscle. And you do that once a week or once every 2 weeks. But your doctor was going to have to monitor a couple things, what your hemoglobin is like or your hematocrit, because testosterone can kind of thicken the blood a bit, so we need to watch that. And they have to monitor your prostate. But the evidence coming out now is that testosterone is actually very safe to take. People were worried about the prostate. That seems to be an unnecessary worry. But Dr. Goldenberg can address it. So it's not the evil thing that we used to think. If you take a shot, what happens is your blood levels go way up and then they go down to actually sort of below normal. So it's very important that that's monitored so that you don't have those big swings. When you have big swings, then your blood thickens too much. But the gels seem to give you a very physiological kind of way of replacing the testosterone. So they're quite popular. Now, if you have ED, what do you do or what do you know about the treatments? First thing, don't just jump to a pill. What can you do yourself? Can you stop smoking? Can you increase your exercise? Think about those blood vessels. Is there any way to make them healthier? Exercise is huge. Has anybody read the book Younger Next Year? No? It's a great book. It's a 70-year-old guy talking about how exercise changes life, followed up by a doctor commenting on it. Younger Next Year is really motivating. I'm not saying if you have erectile problems it's going to cure your erectile problems, but for some people it will make it a little bit better. So there's no downside to exercise. Limit or avoid alcohol consumption. Follow a better diet. Lots of things coming out now about eating better food to help with your blood flow and exercising. So what are the therapies? Well, Viagra was the first one that came out. That's the little blue pill. And now there's some other competitors. Levitra acts very similarly. The best time to take it is about an hour before, and it should work 1 to 4 hours and even up to 12 hours later for both Viagra and Levitra. And Cialis you can take, should work within an hour or 3 hours, but then it lasts much longer. So these are called PDE5 inhibitors. It's a fancy name, but PDE5 inhibitors are very safe to take, and they work very well. And the reason I tell you this is a lot of people say, if I take this Viagra, it's going to cause a heart attack or something. But it actually doesn't. It's actually, well, I shouldn't say, it's potentially almost going to help your blood vessel lining. It's safe to take these pills because there is no increased incidence of heart attack, stroke, any cardiovascular event. And it looks like by taking the pills on a more regular basis, some of the cardiovascular bad things that we see in the blood actually start to get a little bit better. So there's just research coming out on this, but it makes me even more comfortable prescribing these medications.